These are people who the world has given up on, but they have not given up on life. These are the people that just wanted to keep on going, and they make us keep on going as well.
SAMS represents hope through tragedy. The real heroes are the people who are there that no one knows their names. They're there every single day. Some of them have never even had a day off.
SAMS has so much recognition as being the most effective organization in providing medical relief on the ground inside of Syria, and it also has so much recognition as highlighting the work of medical workers and healthcare providers inside of Syria.
When you see the devastation, the degree of destruction that has occurred to the country, and you also see an entire generation now, this has been 4 years, and the impact of what a continual crisis, what a continued civil war, what continued bombing and shelling.
Even little kids playing in the streets would get shot indiscriminately by snipers. So a lot of the injuries we treated were just little kids getting shot in the head, shot in the leg.
You're looking at a lost generation. You have a generation of kids now who know nothing but grief and turmoil, who are working hard with their families as they try to survive.
وصار معك ايش وجعك هلا؟ ايدك وغيره؟ ايه وصدرك. الحمد لله سلامتك حبيبتي. وهي الدبدوب الحلو بده يفرح عليكي كمان الحمد لله.
It's been described as a humanitarian crisis for a good reason. We all know the atrocity that's going on. At this point, we need to look at the future and stop looking at the past and not thinking what happened.
بالنسبة للمصابين عمليا نحن بهالمشفى عم نستقبل اتوقع 60-70 مريض يوميا. احيانا توصل معنا ما يقارب بين يعني 4-5 عمليات كحد ادنى الى 13-14 عملية باليوم. كثير من المرضى بيحتاجوا عناية مشددة.
The field hospitals is a number one. The mobile clinic is a very important thing. You know, we can go inside Syria, whoever's interested.
Our mobile clinics are one of the most innovative responses to the changing situation inside of Syria. There were so many areas where Syrians have been internally displaced, and that keeps on changing. Our mobile clinics are a way to go house to house to provide essential vaccination campaigns, to provide primary care, to provide just all sorts of medical support that's needed.
SAMS is the main organization that doing the work. All the other NGOs are doing a good job. SAMS is carrying the larger scale and most of the responsibility inside Syria.
The outreach that SAMS does, the advocacy and coordination, participation in coalitions that SAMS does with other NGOs, it really helps amplify both our voice and the voice of those other organizations.
Somehow we need to change this formula so we can support the organizations, the NGOs that are assisting the people who are in much need. The population in the city of the Aleppo, which is the largest city in Syria, need to breathe, need to care about development. The civic society need to work. I urge this committee and all House members to support House Resolution 520 that calls the administration to expand humanitarian assistance and stop the attack on civilians.
The more groups that work together, the clearer it is to policymakers and to the international community that we are working hard and we care and we're not going away.
Regardless of however you may feel politically, the important thing is that this is a humanitarian crisis and a human tragedy that all humans must share in bringing and helping these people out.
We just got word of a barrel bomb outside of Aleppo. And a little boy, 5 years old, named Faris, was playing with his two friends, Mohammed and Rami, and they were severely injured in the barrel bomb attack. His two friends were killed, and he was rushed to a SAMS-supported hospital. He lost a lot of blood, and it seemed like he wasn't going to make it. Due to his own resilience and to the amazing work of our medical personnel inside of Syria, he was able to pull through. And as the doctors were talking to him and helping him heal after his surgery and ICU care, they asked him, "What do you want to be when you grow up?" And he said, "I want to be a doctor so that I can also save Syrian lives. And if I was a doctor, then I would have saved Mohammed and Rami, his two friends who were killed." And that's just one example of hundreds of the kind. Children are being healed by the amazing work of our doctors, and this new generation of Syrians is really being supported.
شكرا سامز.
شكرا للسامز.
شكرا للسامز.
أشكر السامز.
We've had this expanded global community that now works with us. It gives us the hope, it gives us the opportunity to build a better future.
شكرا سامز.
شكرا سامز.
شكرا للسامز.
Without SAMS, countless lives would have been lost, and in the future, countless lives would still be lost. Without SAMS, the Syrian medical voice would not be heard inside of Washington, D.C.
شكرا للسامز. شكرا للسامز.
شكرا للسامز.
I'm going to give a promise from myself and everybody else, who worked with this great organization, that SAMS will be here now and for the Syrian people in the future.